Are you a fitness enthusiast or active individual whose low back just seems to go on you from time to time? This is a super common problem amongst the active population. You identify as a fit and active individual, but you just seem to have this recurring problem where you'll train for a while, you'll be hard, you'll be consistent, and then suddenly your low back just goes on you. You need to take time off and really rethink your training, rethink your technique, what's wrong, why is this happening to you. You'll start to feel good again, you'll get back into training, you'll last another few weeks to a few months, and then your low back will just go on you again. I see this in the clinic all the time, and today I'm going to talk to you about why this is happening to you and what you can do about it to break your run of recurring low back issues so that you can continue training consistently without this hassle of your low back or fear of your low back going on you. The first thing I want to talk about is the notion of low back pain. Most people, even active individuals or athletes or fitness enthusiasts, you guys all seem to have this negative view of low back pain. Everyone thinks as soon as something feels off in your low back, if you have pain, if you're stiff, if it's really uncomfortable to do things, that means something's got to be wrong with your low back. It must be super damaged, your back must be totally cooked, and your days are just numbered before you're stuck in a wheelchair for the rest of your life. This is a terrible notion, and it seems to be that the public all just think that the low back is this like fragile structure that's going to explode at any moment, and everyone just generally has a poor perception of what's going on. Now, my experience with fit and active people is that they're generally a little bit more optimistic. Yes, low back pain is frustrating, and especially when it's a recurring low back pain, it's very frustrating. You're probably going to have a better outcome if you're active anyway, so trying to work through this is going to be really important with an optimistic view, because negative thoughts are generally going to exacerbate that pain experience that you're having anyway. So if you are being pessimistic about this, you need to try and reverse that a little bit and get yourself back onto the optimistic side, because that's going to help dramatically. From a physiology standpoint, the reason your low back tends to be something that is considered fragile or can hurt you a lot is because the spine is a very thick structure. However, the spine also contains a lot of what we refer to as danger receptors. And danger receptors are really, in the literature, called nociceptors. And what these guys are responsible for is communicating a potential threat from the tissue in your body to your brain. And in the spine itself, they're just generally speaking, it is very tissue specific, but generally speaking, in the spine itself, you have a lot of density of these nociceptors. So when your body detects that there's a potential threat there and sends that information to the brain, there's going to be a massive amount of those nociceptors firing up and letting you know that there's a potential issue going on here. And in the context of what you're doing, your brain might then start telling you that, hey, there's a big problem going on here, and you start feeling all this pain going off. And if we compare that to other peripheral tissues, say down in your lower leg, like muscles and tendons and ligaments, they're not as dense with the nociceptors. So for something of the equivalent stimulus, you might not feel any sensitivity in those tissues down there at all, and therefore not have a pain experience. It's important to know that sometimes, just depending on the context, these pain experiences, particularly with the lower back, can be heightened in terms of what you're feeling versus what is actually going on at the site of the tissue. The thing about low backs is you can often feel pain there, but that does not mean at all that there is any tissue damage going on. And the other thing to think about too is that depending on particular symptoms, in most cases there's nothing serious going on either. And low back pain in and of itself tends to be worse in the general population who actually don't train at all and, want to go and do a bit of gardening. They pull a few weeds out and suddenly their low back hurts because their tolerance is just so poor that they can't handle doing what we would otherwise consider a very basic task. And the incidence of low back injury in runners, gym goers, and athletes who play field-based, court-based, or any other sport is actually quite low compared to those who don't participate at all. And you're more likely to hurt your back in day-to-day life than you are when you're training or competing. Okay, so you have hurt your low back, it's sore, it's bothering you, you're struggling to bend forwards and backwards, you're struggling to do a bit of rotation or side bending, all of those things. So what's the next step here? You've reduced or you've stopped doing the things that aggravate you, you're taking time off training, and because of this, that loading has dropped and the symptoms start to settle down and your low back actually starts to come good and you're able to move a little bit better and you're feeling good about the whole thing. And as we go through this process and you're starting to feel confident again, you've analysed your training program, you've made some ideas about some technical tweaks you're going to do on some of your exercises so that this problem will not happen to you again. And then you get straight back into training and you start going really hard, you're pushing yourself, you're having a good crack, and then you start to feel this low back flare up again, and it's really bothersome. And the thing to remember with this process is that when you do back off and take time away from training, just because your back is starting to feel better again doesn't necessarily mean that you're fixed. It just means that you're not feeling as much discomfort or pain when you're doing certain things. So pain and injury do not have a one-to-one correlation or a one-to-one ratio. So just remember that. We're looking more at the tolerance side of things. So what is your body, what is your low back going to tolerate you doing, and what is it not going to tolerate you doing? The biggest problem when you're going back to training again after taking time off is jumping in way too quickly. So you've hurt your back, you've taken time off training and analysed the whole situation. You go back to training essentially at the same volume you were doing prior to hurting your back, and you run that gauntlet for a period of time, and then your back hurts again, and this cycle just repeats itself over and over. And this is super common, and the main issue here is because your tolerance has never actually improved, and when you're taking time off from training fully, your tolerance is actually dropping. And if you're even one of those people who is not going to take time off training and just modify things, which is a really, really good idea, but when you do modify training, your tolerance to that specific stressor that bothered you in the first place is also not there. So we need to really slowly integrate our way back into those stresses that are potential causes for a recurrent issue. And when you follow this process of getting hurt, taking time off, coming back at the same training volume, you're never really addressing that tolerance issue, like I said. So you need to really plan an appropriate step-by-step structured way that you're going to get back to full training without blowing yourself up again because you've just jumped straight back in. Because when you do take time off, you're not building capacity or tolerance to a training stress, you're reducing it. And when you're going back to that training again with reduced capacity and stress, your injury risk just shoots straight up because you're going to push way too hard and you're going to exceed the capacity that tissue has to do work. Why is it your low back that seems to be the thing that's recurring? Why is it bothering you on the regular? The thing about low backs is because you use them in pretty much every single thing that you're doing. So if you're running, you're rowing, you're lifting weights, all of those things are going to work your lower back. And you're essentially accumulating load from multiple sources. So this is training, this is life stress such as work or social life. Maybe you've had to pick up the kids because they don't want to walk and now they're getting all sooky and you got to carry them home. All of these things are going to start loading your body and loading the tissues that potentially don't have the tolerance and capacity to do the work you want. And so you're getting all of these stresses coming in from multiple angles, and it's very easy when you realize that for your body to become overloaded in ways that you didn't necessarily think that could potentially overload you. So your common mistakes that are going to keep this issue going, okay? Number one, I've said this a million times already, taking time off completely when you're in pain. This is the number one thing you do not want to do. If you want to lose capacity and you want to lose tolerance and therefore increase your injury risk when you come back to training, taking time off is the best thing in the world. But if you don't want any of those things to happen, don't take time off, because it just doesn't work. The second mistake is avoiding movements completely. If, for example, your low back is particularly sensitive to doing a deadlift off the floor, it doesn't mean that you just can deadlift forever. It means that we modify the deadlift movement to something else that is potentially a little bit less provocative for your lower back. So maybe you're doing something instead that you can't load as heavy, like a Romanian deadlift, or you're just not pulling from the floor and pulling from a rack pull or a block pull. Something along those lines where you can just change the stress a little bit but still perform a similar movement pattern and a good training stimulus. Because if you avoid movements entirely, you're just going to decondition to that specific thing, and you're further going to reduce your tolerance to be able to handle the work. The next issue is focusing only on fixing your lower back. Now, this is a big trend among people with lower back pain. All you do is start focusing on mobility drills, core exercises, trying to isolate just your glutes or your TVA. And in some cases, those drills can be useful, but generally speaking, you're not addressing the total load on the system. And when you do these sorts of things, you can look at doing everything perfectly. Your technique can be spot on. Everything's going to be super aligned, like, man, everything can just be bang on, and you can still exceed your capacity as soon as you start to train hard again, because you just haven't focused on building that total, well-rounded capacity that you require to do the things you want to do. So for your low back in particular, you need to start thinking about how are you going to increase your tolerance to load? How are you going to increase your capacity so your low back can handle more work? You need to stop focusing so hard on how can I just get rid of this pain? What can you do? What are the things that you're going to start focusing on to get you out of this recurring rut that just keeps bothering you over and over again? The first thing is a very gradual return to loading. You need to make sure that you're tracking how your low back is tolerating the work that you're doing, and then you need to have a plan on what you're going to add and then potentially what you're going to subtract from your training so that you can make a steady, slow progress and make it as predictable as possible. The main idea here is that you're chasing progression, not perfection. If you start chasing perfection, you're probably never going to get there because it just doesn't exist. And even if it does exist, we'll end up not knowing what perfect actually is because you can only do one thing at a time. You can't try all these different things to figure out perfect. The things you need to monitor for your low back are going to be how much does it bother you during activity, how much does it bother you after the activity, and then how much does it bother you the next day. And then when you start monitoring those things, you can gather some really good, strong, objective data, and then you can use that data to develop weekly trends and start to understand across the course of a week how you're pulling up from training, and then make appropriate adjustments from there. You're probably not going to have zero pain all the time, and you need to understand that a level of pain is normal as long as it's tolerable. The main thing is how your lower back is responding to what you're doing over time. So remember, if you're a fitness enthusiast or amateur athlete whose low back pain just keeps recurring, you are definitely not alone. I see this in the clinic all the time. You're definitely one of these athletes who are super disciplined, you're super consistent, and your training is generally pretty good. However, just because you are one of these athletes who are super disciplined and you're training really well, doesn't mean that you're just immune to getting injured all the time. And to learn more about that, have a look at my video here on why disciplined athletes are still getting injured.